I'm Fallon, and honestly, I am a mess. Actually, I'm a dual board certified nurse practitioner, both in primary care and in mental health. I help people talk about the psychology of eating, the emotional weight of body image, almost every single day. And this week, I gave myself my first injection of Mounjaro. And here's why. Now, I'm trained in both medicine and mental health, but I chose behavioral health the last 7 years of my career because I saw this is where people struggle the most. Um, a lot of times, people couldn't manage their health problems or their illnesses or diseases because their mental health was not in place. Their mental health was all over the place. They had anxiety, depression. All of those things affect how we can take care of ourselves in general. And so I felt like I wanted to learn even more on how I could manage that for people. Now, you cannot separate the brain from the body. Anxiety makes you eat at midnight. Depression can steal your energy to cook or want a meal plan or exercise. Trauma can actually live in our tissues, and the body keeps score. There's actually a book about that. And then shame can pile onto everything. I see it, I treat it, and you want to know what? I live it. So this channel isn't going to be about provider Fallon. It's going to be about patient Fallon. The woman in her 40s, mom, wife, business owner, human Fallon. Because here's the truth. Being a healthcare provider doesn't make you immune, does not make you immune to anything. Sometimes it just means that you know what's wrong and you still can't fix it, which let me tell you is so absolutely frustrating. So I'm documenting this journey, the good, the awkward, the frustrating. I feel like if I'm honest, then you might not feel so alone in your journey. Now, a little disclaimer here. I am a medical provider. I am not your medical provider. So everything I talk about is from my lens, behind and in front of the stethoscope, clinical information, and my own personal experience. But please, please, please talk to your own provider about your health. I am not giving medical advice to anyone. This is just education and knowledge. And you get to peek into my journey. Now, let's back up. And I'm going to tell you a little history. So in about 2015, I had gastric sleeve surgery, or VSG. I'm sure you've heard of it, where they kind of cut half of your stomach, remove half, and smaller stomach, lower appetite, weight loss, correct? At the time that I had surgery, I probably weighed about 300 pounds. Now, I've been a nurse for 25 years, and so all of my career and experience, I have did a number on my body, night shifts, day shifts, 12-hour shifts, 16-hour shifts. Like I have done a number on my body, cortisol levels through the roof probably. Just stress on my body, not eating well. And I'm only about 5'1", okay? So I'm also short. Now I had tried everything. Any diet you can think of, I had tried it. Every diet, a workout plan, a trainer, every magic idea that came out. And the irony is I knew the science. Calories in versus calories out, metabolism, behavioral change, trauma work, therapy, all the things, all of it. And my body still didn't cooperate. Now we know that that's a part of biology, but we'll talk about that later. Actually, to be honest, my body never cooperated. I went on my first diet in about third grade. I think I was 8 years old. And I can distinctly remember being overweight I've been overweight my entire life. I'm from the South. Both sides of my family have diabetes, blood pressure, high blood pressure, heart issues, strokes. Like it's on both sides. And we grew up eating, and you know how we celebrate in the South. Every celebration is about food, right? It centers around it. But I grew up in that, and I was probably 8 years old when I went on my first like diet or tried to stop eating so much. And I was overweight in school. I can remember being about 7 or 8 years old and starting to be chubbier than other people. Before that, I was probably, right along with everyone else. Always had chubby cheeks, that kind of thing, but I started to really gain it. And I had a best friend in school who was also overweight. And so we were both overweight and kind of stuck together with each other, right? And I remember in fifth grade, we came back from the summer break and she was skinny. And everybody had grew and everybody had gotten skinnier and everybody's face was thinner and they didn't have the baby faces anymore. And I was still overweight. And so I can distinctly remember that it has been a struggle ever since then. So fast forward again, in 2015, I'm now up to 300 pounds. And I chose surgery. At first, to be honest, it worked beautifully. I lost some weight, about 80 pounds. I felt strong. I even felt kind of hopeful that, like, okay, like my stomach is only half and I have this restriction, right? And I can keep this off. And I thought, finally. But let me tell you something. And I knew this going in. Bariatric surgery is not a cure. It is a tool. And tools can fail. And over time, I regained at least 60 of those 80 pounds. And the shame that came with that was crushing. I'm a nurse. I'm a nurse practitioner. I'm a healthcare provider. I know how this works. I know what needs to be done. And I could not fight my biology. Back then, talking about GLP-1s and talking about metabolic syndrome and metabolic health, and we talked about it a little bit. We learned about it a little bit, but it wasn't extensive. And it was just really becoming mainstream and the puzzle pieces being put together. And so, of course, we all walked around thinking, well, we had just failed, right? I felt like I had just failed in keeping the weight off. Clinically, I knew regain was common. Like I think 20 to 30%, the studies show that 20 to 30% of people who have bariatric surgery experience regain. And I know the hormones and I know the psychology, but when it's your body and all that knowledge doesn't protect your heart, you still feel like you failed. Now, I've done the therapy, tracked the food, done everything right, and still my body fought me. Then came my 40s. Enter perimenopause. Ladies, if you're out there experiencing, I don't even have to say what that feels like. But it's like life goes, oh, let's add some more chaos to the fire. Hot flashes at 2 a.m. Brain fog. Oh my God, the brain fog. Like in the middle of charting, forgetting what you're saying. And that has never happened to me in 20 years. Mood swings, fatigue, wanting to take a nap in the middle of the day. I have never been a napper my entire life. And all of a sudden, I need one in the middle of the day. Weight gain around the middle. I carry a lot of my weight around the center, which is, right, the bad composition, because that means you have a lot of visceral fat. And we'll talk about more about this later, and have a lot of fat around your vital organs. And so all of this can be a bad thing. It's a bad metabolic setup for me, okay? And it just made it worse when perimenopause came in, because the hormone levels drop, insulin gets weird. I was already diagnosed with PCOS a few years back, and it kind of cleared up a little bit, and then with some weight loss, and then the insulin resistance was still there as well. Okay, so now it's getting even weirder. Cortisol spiking. My body is basically going, good luck. That's what's happening in perimenopause. And the wild part about it is perimenopause can look exactly like anxiety or depression or both. I've had patients that come to me and they think, I don't know what's going on with me. I've had women come and say, I don't know what's happening. My moods are all over the place. I'm having mood swings. I can't get out of bed. I'm so depressed. And they think they need psychiatric medication. And really, when we dig deeper, it's their hormones. So imagine knowing all that and still feeling awful. I teach this stuff all day, and I'm living it all day. It's exhausting. So here I am, post-surgery, weight regain, perimenopausal, running a practice, being a mom, being a wife, and just wanting to feel good in my skin. Which brings me to Mounjaro. Now, GLP-1 medications get a lot of noise online. Some of it is helpful and some of it is absolutely ridiculous. But clinically, I've watched them change lives. Not just the weight, but the mood, the energy, the hope that people have. So I didn't jump into this, of course. I did my research. I researched for months. I look at the research articles and I compare them and the labs and the risks and the benefits and my history and my psychology, everything. And let me tell you, this isn't about being skinny for me. Since I became a mom in 2019, it's about being healthier. I want to be here for my kids. It's about lowering my cardiovascular risk, managing my hormones correctly as I continue to go through this perimenopausal journey, which can be a very long time for women of color. Having energy for my practice and my patients, and breaking the restriction regain cycle. So I want to get nerdy for a minute, okay? So stay with me. And I'm just going to talk about the science kind of a little bit behind GLP-1s. Now, there are two main types of GLP-1s. Okay? There's semaglutide and then there's tirzepatide. Those are like the big umbrella types. Okay? When you talk about semaglutide, you're talking about Ozempic and Wegovy, which you've probably heard of. And so, for example, Ozempic focuses on weight loss and diabetes, whereas Wegovy focuses on helping with weight loss as well, but also can be for people with higher cardiac risk, so it can help with cardiac health a little bit better. Tirzepatide umbrella, underneath that umbrella is Zepbound and Mounjaro. Okay. Zepbound is used for obesity and weight loss as well, but studies show that it can also be very helpful for people with obstructive sleep apnea. Whereas Mounjaro can be helpful for diabetes, of course, insulin resistance, metabolic health, and the weight loss. And Mounjaro is considered the big gun. Like, this is the strongest one, and this is like the big boy. Okay. Now, Mounjaro works on two hormones in the body, GIP and GLP-1. Now, we'll talk about what those are a little bit later. But for my situation, this makes sense. I will get better insulin control. Remember, PCOS, insulin resistance, all of those things that I have. It will give me metabolic support, okay, and the cardiovascular benefits. And I have mild hypertension and some elevated cholesterol. Okay, so it's going to give me all of those benefits. Now, here's the part that fascinates me as a behavioral health nerd. These medications have been found to also help the brain's reward system. Now, you've probably heard of the reward system when people talk about alcohol or sugar or other drugs or different things like that. But it also helps when it comes to eating because you can have less compulsive eating, right? The compulsive standing in front of the refrigerator looking to see what's there, even though you bought what's there, you know exactly what's in there and what's not, but you go back 12 times a day to look at it. That compulsive need to go and see what's to eat, the food noise, which I just realized and found out that a lot of people don't have food noise because I've lived with food noise my entire life. And better executive functioning. So this can help in a lot of ways on the mental health end as well. Now, this means that it isn't just willpower, it's biology. And if I prescribe a medication for someone to come to me with saying they're depressed or anxious or they have a mood disorder, why wouldn't I treat metabolic health the same way? It is also biology. So I gave myself my first injection and I'm going to document everything. So let's talk about what you'll get here on this channel. Weekly updates, anything, side effects that I have, how my mood is going, energy, the real stuff, like how it's really affecting me daily, behavioral health insights, how I'm doing with my emotional eating, because I'm an absolute emotional eater. I learned that as a kid. You know, it would be the saying, well, what do you feel like eating? And just think about that statement. What do you feel like having? That is how I lived my entire life because it was everyone around me was all about, well, what do we feel like eating? Like what's going to be delicious and make us happy and make us giddy? Like what is that? And that is definitely emotional eating. We're going to talk about trauma. We're going to talk about body image, especially for me as someone who's never been thin, to get to a place where I'm going to start to actually not be plus size or not be thin. I don't know what that's like in my adult life ever. I don't know what that feels like ever. I've never worn a 12, a 10, like never. So it's going to be really interesting to see how that affects my body image and talk about that with you all. We're going to talk about perimenopause, the truth about that, and how it affects things, and how hormone replacement therapy can affect how you use GLP-1s as well. It's going to be some clinical explanations without all the medical jargon, just everyday speech so you can understand what it means. And all the messy parts too. Weeks where nothing works, weeks where I cry, weeks where I win, but always honest. Because I'm done pretending that as providers we have it all figured out. We don't. We're human too. If you're over 40, if you're tired, if you're frustrated, if you feel invisible, if you feel like you've been fighting this weight loss battle with no end in sight, you're in the right place. Let's figure this out together. So, subscribe if you want to follow the journey. There'll be new videos every week. Drop a comment for me and tell me what you're struggling with right now. Weight, hormones, perimenopause, mental health, all of it, any of it. You're not alone here, okay? You can find me on Instagram at Fallon G, Midlife NP. And next week, we're going to talk about how my entire week 1 of Mounjaro went. Any weight loss, any mood changes, anything, whatever I felt, anything that I felt different. And we're going to talk about the good, the bad, all of it. Thanks for being here. And I'll see you next time.